Welcome to our exploration of oral microbiology. This field focuses on the tiny microorganisms living in our mouths, which play a huge role in oral health. Understanding these microbes helps us grasp how they influence dental conditions and overall oral wellness. Let's talk about the normal microbial flora, the community of microorganisms that naturally live on our skin and mucous membranes. Some of these microbes are permanent residents, always present at certain ages and locations, while others are temporary visitors from the environment that don't cause disease. Knowing this helps us understand the balance in a healthy mouth. Why study oral microbiology? Because it's essential for dental practice. A basic understanding allows us to diagnose infections accurately and plan effective treatments. Many key oral diseases, like caries and periodontal disease, arise from changes in the mouth's bacterial ecosystem. So, grasping these processes is crucial to preventing and managing these conditions. The oral microbiome is a complex ecosystem made up of bacteria, fungi, and viruses unique to each person. It includes all the microbes and their genetic information interacting within the mouth's environment. This ecosystem exerts pressure that helps prevent harmful non-oral organisms from taking hold, maintaining a delicate balance, important for oral health. Our mouths have several habitats where microbes live: the cheek lining, tongue surface, teeth, gum crevices, and even dental appliances or fillings. Various factors influence microbial growth here, like the anatomy of the mouth, saliva's complex makeup, diet, and interactions between microbes themselves. This dynamic environment shapes the oral microbial community. At birth, a baby's mouth is sterile, but within days, bacteria like viridans, streptococci begin to dominate. As teeth emerge, anaerobic bacteria establish themselves, and by the end of the first year, the oral flora resembles that of an adult. This journey shows how the oral microbiome develops and adapts over time, laying the foundation for future oral health. Key bacteria in the mouth differ by location. On tooth surfaces above the gums, various streptococci species dominate. Below the gums, a diverse group including gram-positive cocci, gram-negative cocci, and rods like lactobacilli and fusobacteria play roles. Understanding these bacteria helps us see how they contribute to oral health and disease. Dental plaque is a dense biofilm of bacteria tightly adhering to teeth. It plays a central role in tooth decay. Plaque can be supragingival, found above the gum line, subgingival below it, or marginal, directly in contact with the gums. Recognizing these classifications helps us target prevention and treatment effectively. Dental plaque forms through a stepwise process. First, bacteria attach to the tooth surface. Then, they multiply and form a biofilm, producing an extracellular matrix that stabilizes this community. Eventually, a mature biofilm develops, creating a complex bacterial ecosystem firmly attached to the tooth. This process is key to understanding plaque's role in oral disease. The sequence of oral biofilm formation starts with pioneer colonizers, mainly gram-positive cocci and rods, attaching to oral surfaces. Neisseria species consume oxygen, creating conditions favorable for anaerobic bacteria. Over time, gram-negative and filamentous bacteria join, forming a complex, structured biofilm essential to oral microbial ecology. As dental plaque develops, bacteria produce sticky polysaccharides that help them adhere firmly to tooth enamel. This leads to a mature biofilm with a characteristic corn cob structure where bacteria are tightly packed. Over time, these biofilms become more resistant to antimicrobials, making them harder to remove and control. Here we see a close-up microscopic view of bacterial colonies. Such images help us appreciate the dense, complex nature of bacterial communities involved in oral health and disease, highlighting the importance of targeting these microbes effectively. Calculus forms when plaque biofilm accumulates minerals like calcium and phosphate, hardening into a calcified mass. Bacterial enzymes break down inhibitors that usually prevent this calcification. Calculus serves as a reservoir for bacterial toxins, making its removal essential to maintain periodontal health and prevent disease progression. Dental caries is a chronic infection caused by an imbalance in the normal oral microbiome. Bacteria ferment dietary sugars, producing acids that locally destroy tooth tissues. This process reflects a shift in the microbial ecosystem on tooth surfaces, leading to the progressive breakdown of dental structures. Several factors contribute to dental caries. Host factors like tooth structure and saliva quality play roles, as do dietary habits, especially the intake and frequency of fermentable carbohydrates. The composition and behavior of plaque biofilm microorganisms also influence caries development, highlighting the multifactorial nature of this disease. Dental caries progresses through stages starting with a white spot lesion, which is an early reversible sign. If untreated, the enamel surface roughens and cavitation occurs, spreading into the dentine. This can lead to pulp inflammation and necrosis, eventually resulting in abscess formation if infection extends beyond the tooth. Caries development stages include enamel decay, dentin involvement, pulp inflammation, and potentially periodontitis. Recognizing these stages helps guide treatment decisions and emphasizes the importance of early detection to prevent more severe complications. Initial caries lesions form when frequent sugar intake lowers plaque pH, leading to acid production by bacteria. This causes a chalky white spot on enamel, signaling early decay. Fortunately, these lesions can be reversed through remineralization if proper care is taken, highlighting the potential for prevention and healing. As caries progress, enamel roughens and cavitation spreads into dentine, causing pulpitis. Without treatment, pulp tissue dies, leading to necrosis. Complex biofilms then form in root canals, dominated by anaerobic bacteria. This progression underlines the need for timely intervention to avoid severe infections. Dentoalveolar abscess forms when infected pulp tissue dies, and biofilm spreads through the root canal into surrounding tissues. This leads to abscess formation in the periapical area, which can extend to alveolar bone and even the maxillary sinus, illustrating how oral infections can spread beyond the tooth itself. The journey of dental caries starts with a reversible white spot lesion. If not managed, it progresses to irreversible enamel cavitation, then dentine involvement, pulp infection, and necrosis. Finally, an abscess may form due to necrotic pulp infection. Understanding this step-by-step progression is key to effective prevention and treatment. Preventing dental caries involves multiple strategies. These include fissure sealants to block vulnerable grooves, controlling cariogenic bacteria through brushing and antimicrobial agents, dietary modifications to reduce sugar, fluoridation to strengthen enamel, and regular dental checkups with microbiological assessments. Together, these approaches help maintain oral health. Fissure sealants protect teeth by covering grooves too narrow for toothbrush bristles to clean effectively. Applying sealants prevents tiny cavities from forming in these vulnerable areas, making them a simple yet powerful tool in cavity prevention. All prevention strategies aim to reduce dental caries by controlling sugar intake, strengthening enamel with fluoride, creating physical barriers like sealants, and managing microbial balance through good hygiene and antimicrobials. This comprehensive approach targets the root causes of caries to maintain healthy teeth.